my instructions, follow my lead, and we'll do that here. So we're going to take a big deep breath in, take a sip of air at the top, hold it and squeeze. And then slowly exhale. Just like that. Perfect. Okay, good. Okay, so so let me also post the title of the video here in Facebook so people can kind of get a sense of what the title is, because sometimes the title goes away on Facebook once you're watching the video. So you can see in the chat what we're talking about. Okay, so uh, let's jump into it. So first, to set the stage, we all know that the human body is a very complex network of nerves and systems, all working together to maintain optimal health. This is obviously what's happening. One very crucial component obviously is your vagus nerve. And I know some people here are long-term watchers and listeners, and some people might have been approved into the Facebook group a few days ago. So we always want to cover the bases, right? So recent studies have shown that damage or impairment to the vagus nerve can lead to an increase in chronic stress, adrenaline levels, also known as noradrenaline or beta adrenergic levels, and that can also increase your cancer risk significantly. The video today will shed light on these connections, how they connect and plot together, and emphasize the importance of managing your stress and maintaining vagus nerve health. This is if you need an excuse or a reason to do any of the stuff, any of the practices, do any of the stuff that we have here in the Facebook group, or maybe you're on TikTok and you love watching those little vagus nerve little TikTok videos, this should give you some compelling reason to do something about it, I would say. In my opinion, I don't know. I'm pretty not jazzed about getting cancer, personally, but to each his own. I mean, hey, it's a new world, right? So that could be your kink. Who knows? So anyway, nope, I'm not going to judge you. But so let's start with this. So chronic stress and the vagus nerve, right? So we know that chronic stress today, more than ever, is pervasive in today's fast-paced world. When the vagus nerve gets damaged or impaired, and how does the vagus nerve get damaged or impaired? Stress itself can literally turn off your vagus nerve. Generally speaking, your vagus nerve is there to calm you down. Your vagus nerve is intended to slow things down in your body. But if you have too much stress persistently, this happens a lot in cases of post-traumatic stress disorder. Military folks, people in a war zone, people who are being abused constantly, physically and verbally, and emotionally and spiritually, can develop impaired vagal function just because the stress is an onslaught. It's a never-ending onslaught into their system. And that actually really sucks. And that can actually deactivate the vagus nerve. Other ways in which the vagus nerve can get damaged, leading to all the consequences that we're going to talk about today, are car accident, infection, illness, poor diet, overeating, alcohol, drug use, nicotine dependence. There's lots of chemicals in the food supply. There's lots of chemicals in our water. There's a lot of additives. There's a lot of things about what we eat and the drugs that we take today that have been shown to negatively impact the vagus nerve. So this is really there's a lot of avenues for issues here. Another one that we've been talking about a lot this week in the Facebook group through videos and posts and conversations is the risk of surgical damage to the vagus nerve from a surgery, right? So this could be you get a thyroidectomy, you get a Nissen fundoplication for reflux, there's all kinds of surgeries that people have. An appendix removal can cut right through the vagus nerve, and some of these surgeries can contribute to infection of the vagus nerve itself because you're cutting the nerve open, you're leaving it susceptible to infiltration of bacteria. And also, anytime you cut something, it kind of reacts like, ugh, like that. Like think of if some animal gets hurt, how it recedes back like this, it gets wounded. I mean, cutting into the vagus nerve, you're cutting into a pretty substantially conscious thing. I definitely believe the vagus nerve itself is a conscious, almost like a living entity. And cutting into it, it's going to remember that. It's not going to forget that you did that to it. It kind of acts, it's almost like it acts like a little child sometimes. It's like our inner child. Some people have noticed that connection. So those things can exacerbate the consequences that we're looking at. So the vagus nerve plays a crucial role in regulating so many of your body's stress responses, and it's not limited there. When the vagus nerve is functioning properly, you'll typically see that the vagus nerve can lower your heart rate. So a low heart rate, that's safe, right? Low 50 beats per minute, that's low. That's good. That's healthy. That means your vagus nerve is keeping things controlled and tamped down. It also regulates your blood pressure to be right in the perfect range. Not too high, not too cold, not too low. It promotes feelings of calmness. But when it's damaged, these stress-regulating functions can be disrupted, which can lead to increased chronic stress. Chronic stress then leads to the next thing, which if you have chronic stress, then you're typically going to see your adrenaline levels start spiking. And then you're going to see cortisol levels start spiking as well. And this creates a cascade of issues which we're going to talk about here. So adrenaline fuels the sympathetic system, and this is also known as the fight or flight system. Your sympathetic system is the opposite, basically, of your vagus nerve. It's another factor that is counter-signaled by the vagus nerve. So if you're stressed, usually, if you know how to self-regulate, your vagus nerve will come in and say, hey, it's okay, calm down, it's going to be all right, it's going to work out just fine, you don't have to be stressed out so much right now. And that's kind of what your vagus nerve does. Oops, I just got a call there. So under normal circumstances, the vagus nerve helps to control adrenaline release, ensuring that that it's produced in the right amounts during stressful situations. However, if the vagus nerve is impaired, this regulation mechanism, this control valve can get messed up. It can go awry, as they say. And this can lead to excessive adrenaline levels. This can result in symptoms like an increased heart rate, high blood pressure, and anxiety. And that, if persistent enough, can lead to increase in cancer risks. So, perhaps most alarmingly, the damage to the vagus nerve or impairment of the vagus nerve, this even comes, folks, listen, if you don't do anything to make your vagus nerve happy, if you guys are listening right now and you're like, I don't think I do anything that could be considered vagus nerve friendly at all, then you need to listen up. Because non-use of a nerve like the vagus nerve is on par with damaging it. If you've never done algebra since college or since high school, you have no ability to use that part of your brain. It's very difficult to use it. I'm fluent in Spanish. Hola, me llamo Sterling. Mi día está muy bien. I lived in Spain. Now, my Spanish is a bit rusty if I don't use it that much. But if I start using it again, it comes back online. Most people aren't doing anything to help their vagus nerve whatsoever. And as time goes on, you oftentimes have to do more and more and more to get your vagus nerve to respond in the same way it worked when you were younger. So you see this with muscles, right? A 20-year-old young man or woman going to the gym, 20 years old, lifting weights, can develop big muscles throughout their body. But the same person at the age of 50 has to go to the gym 3 or 4 times as much and lift 3 times as much weight just to be able to get maintenance of the muscles that they have so they don't lose them. So the older you get, the more crucial it becomes to just hang on to what you have. So most people are still thinking, what worked for me 20 years ago is gonna work for me at 50, and it's not. So when we're talking about vagus nerve stimulation, we're talking about a real practical form of keeping your vagus nerve working. Because do you guys really want to risk it? I mean, do you really want to have that conversation? There was some girl who came into the Facebook group. It must have been 2 months ago. She's probably left by now. But she just made this big post like, you know how I post all kinds of stuff about how to work with the vagus nerve naturally, with technology, with devices, with red light, with ultrasound, with tons of stuff, breathing methods, rubbing the ear. I mean, I post about food, how different kinds of food can modulate your vagus nerve. And her message was, and our people that join the Facebook group are people who are like damaged by benzodiazepines, medical malpractice victims, basically, surgically damaged, a car accident that pinched and crushed their vagus nerve, people who were having like severe traumatic related vagus nerve dysfunction. And she's like, this is how I interpreted her message. Of course, I'm not trying to read her mind. Maybe she had much better intentions, but here's how it came off. Can you guys recommend like anything that's like non-technology based? Like, does anyone need the technology part here? Can't you just do this naturally? Like, is there one thing that this group could recommend that's not technology? And I was like, for someone who has like epilepsy, who is having a seizure constantly, or who has severe migraines, breathing and clove oil on your ear is not going to work. And this group is not intended to, the work that I'm doing doesn't cater to the 22-year-old girl who's an influencer on TikTok that lives in Fiji, okay? This is for the 54-year-old mother who had mold exposure over the last 10 years and didn't know it and is dealing with just hanging on for dear life, okay? She doesn't give a shit if it's ultrasound or if it's clove oil or if it's breathing or if it's getting into a cold shower every once in a while. These practical real life or death cases, they're not like, oh, technology. Like you're literally posting that through a phone, through the internet, through satellites. Is this really the best time to be browbeating me or any of us about technology? And especially given that we're talking about Salk Institute. Salk Institute is one of the biggest research institutions in the world that's looking at how to prevent cancer. Like Salk Institute is one of the highest in the world. They're like Oxford, Cambridge University level of research. They're talking about if your vagus nerve gets injured and stops working, that it's 1, 2, 3 steps to cancer. I don't give a shit. I don't really care if it's a piece of technology at that point in time, if it means that I'm not going to get cancer, okay? So let's talk about this, right? So here is the alarming consequences that can get you to cancer from vagus nerve damage. So this is known as a phenomenon called T cell exhaustion. So T cells are a part of your immune system. And when the T cells are constantly, T cells normally work to regulate inflammation. But when there's so much adrenaline floating around and hitting the receptors of those T cells, they hit something called exhaustion. Now, exhaustion is an anthropomorphic term. When I think of exhaustion, I think of a large human person who is coming home from work and just like, oh my God, I'm so tired, right? That's what exhaustion is. So when we're thinking about a single cell organism called the T cell, what does that look like? It's not the same, but it's the equivalent. Something radically chemically changes here, and this thing shifts. It like morphs into basically a white blood cell that is unable to identify tumorous bad cells, doesn't even care anymore, and it just can't even see cancer developing in the body. Because did you guys know that every day there are cells that are marked for apoptosis? Basically, there are cells that are precancerous throughout your entire body that white blood cells, that T cells are going and hunting down and killing. If those T cells are exhausted from constant stress and adrenaline onslaught because you couldn't be bothered to sit down and relax a little bit, or you're so up your ass because you're like, I don't want to use any technology. I love clove oil and crystals and all kinds of stuff. There are definitely cases where people who are hippies get cancer and die. So this is, just being I think you should be all natural as much as possible, right? I'm a big paranoid person when it comes to ultra processed foods and oils and face chemicals and toothpastes, and gosh, what you use for laundry detergent, for Christ's sakes, has so much weird stuff in it. So I'm very paranoid about all this stuff. So I think you should be careful. But there are things that are effective that don't require like hardcore chemicals. I'm a big fan of using sonic-based medicine. So that would mean, how do frequencies influence the function of neurons in the body? How can you modulate vagal nerve activity with ultrasound is a big question that I have right now. And ultrasound, just so you know, is freaking just sound waves. It's just high-frequency sound waves. The kind of sound waves that like a bat would use to ping sonar in their environment to be able to hear. Bats, they can see, but they use echolocation with high frequency chirps. They go beep, and the sound bounces off the wall and comes back in their ear, and they can almost have a visual sense of what's going on. Dolphins do the same thing. So dolphins don't use just their eyes to see the environment. Right under their forehead, they have this big, huge transducer, a horn, a vibrating plate that shoots out sound waves that are high frequency in the water, and it bounces off the target. Somebody did a pretty incredible piece of engineering, and they were able to decode what a dolphin sees, and they had a dolphin ping a guy, a scuba diver. And you could literally see the entire body outlined in that picture that the dolphin made. So dolphins can literally see things with sonar, with sound. No chemicals, no drugs, just sound. And so the largest whale, I think the blueback whale, they click, they have these clicks like this. And these are the biggest whales in the world, right? The huge mega whale. Their clicks, their sonar is so loud that you can't get close to them while wearing any kind of scuba equipment, because it starts to bash into the metal of what they're wearing. And I believe it hurts or something like this. Like, it's just not good. So it's wild. But basically, the thing that I love to see is how do we utilize sound, sonication, to modulate the effects of stress so that your stress doesn't end up hurting you so much. This is, I think, the new wave of science. This is the new wave of where research should be. So I think that we can prevent the development of tumors and of cancer if we are able to safely modulate the vagus nerve with things like sonication. Vagus nerve sonication, not electricity, but with sound. Sound, I think, is a way more appropriate way to go about this. So yeah, basically, just before we move on to the next section, when the vagus nerve is damaged from all the ways that I mentioned earlier, T cells can become exhausted and less effective at fighting off disease. And in some cases, they may even contribute to the growth of cancerous tumors. So this is the process. It's 1, 2, 3. It's not that far off between chronic stress, adrenaline pumping, T cell exhaustion, and then cancer growing. Basically, cancer having a cheat day. Just grow as much as you want. No T cells will be there to monitor it or to prevent it. And this can all start with the vagus nerve being damaged or not functioning, or you just basically not having the time or not really caring too much. You know, I was too busy watching TikTok videos to care about this guy wearing a hat and a Columbia hoodie, to pay attention to any of this stuff. It didn't seem important at the time. It will become important at some point in time, I'm sure of that. But hey, to each his own, right? I mean, shit, have you seen TikTok videos lately? They're amazing. I mean, why would you want to waste your time thinking about this kind of stuff? Why would you want to spend any time learning about this and trying to not die? I mean, you're going to miss the stream of literal human excrement on TikTok if you're not on there all day long. So, yeah, no worries. Hey, it's all good. All right, so let's jump to the next section. So, the importance of managing stress and vagus nerve health. So, getting close to the conclusion here before we're the penultimate section. So, given these potential risks, which are obviously here, managing stress and maintaining vagus nerve health is clearly more important than ever before. Here are some ways that you can go about keeping your vagus nerve healthy. I believe that regular exercise, which includes walking, weightlifting, neck strengthening, can all contribute to healthy stress regulation. Okay? If you're not exercising, you are really messing up. Every piece of major research says that you should be walking every day. You should be doing high intensity exercise every day. You should be lifting weights every day. If you're over the age of 40, these become musts. These don't become, I didn't have time to do a 10-minute walk today. I'm sorry. I've been sitting on my ass for the last 3 weeks. I'm sure that's not healthy. That's going to contribute to all this. Secondly, a balanced diet is important. That means getting good supplements, getting good ingredients of your food, keeping things simple, keeping things not ultra processed. If you're drinking soda, stop it. If you're drinking alcohol, just fucking stop it. Alcohol is so absolutely poison for your body. We've seen cases where overeating and alcoholism basically manifest in the same way, and they directly affect your vagus nerve. They demyelinate, they destroy your vagus nerve. How do we know this? Because we took people back in the 1980s and we cut their bodies up after they were dead. And we looked right at their vagus nerve. We cut, basically, get this. It's definitely something from a horror film. But we are in we're almost in October, so it's almost Halloween, so it's almost super up our alley. But yeah, they would basically cut someone's head off, look at their vagus nerve, and see that in cases of alcoholism and or overeating, right, two different populations, their vagus nerve had withered into like half the size. So yes, there are obvious bad things. And don't listen to the bullshit research that says, well, drinking a bunch of wine is healthy. Who do you think sponsored those studies? Okay. Resveratrol is probably good for you, but we do know that alcohol is bad for you. It's poison. Stop drinking it. Okay. Adequate sleep is important. Mindfulness practices such as meditation or prayer can all help to support vagus nerve function and reduce stress levels, right? Doing things that are nice and good and relaxing for your mind and for your body and for your vagus nerve are really super important. So, additionally, if you suspect your vagus nerve may have been damaged, it's crucial to seek medical attention promptly. If you believe that there's something more severe going on with your vagus nerve, you need to immediately reach out to a specialist of some kind who can get you help for your vagus nerve, okay? Sitting around and waiting and not taking action on this is going to build up this process that we've talked about today. T-cell exhaustion is a process that works under the surface. You're never going to know it. You're not going to feel it. There's no effect from it. There's no drug. There's no chemical production here. You are literally just going to slowly, silently develop cancer if you don't take care of this kind of stuff. This is what the paper shows, you guys. I'm not making this up. This is what the Salk Institute published. And I'll put the link here again. Absolutely, we'll put the link here in Facebook again, because some people are like, I'm sure, not believing what I'm saying. That's at nature.com. Nature is the biggest publicator of this, and this is from the Salk Institute, which is huge. Okay, so get medical attention immediately. If you think your vagus nerve got crunched, if you know your vagus nerve is not working, if you have the symptoms of vagus nerve dysfunction, I will also post the website, vegushub.com/symptoms. SYMPTOMS, symptoms. vegushub.com/symptoms. You can go to that link and you can read what the symptoms are that are telltale signs of vagus nerve dysfunction. You may not realize it, but some of the things that you're experiencing in your health could be indications that your vagus nerve is faltering, and that is going to allow these processes to start. That means your body is being flooded with adrenaline all the time, and your T cells are getting exhausted. This is bad. This means that cancer can basically thrive in your body without any challenge to it. Okay? So, in conclusion, as we went through this, the vagus nerve plays a critical role in our overall health, right? If I haven't made that point clear today, I don't know what else I could say. If it's, preventing the development of cancer that can kill you, and you're not getting that through, then I feel like I've done a pretty good job of making that point. But it does play a critical role in your overall health and your well-being. By understanding its functions and taking steps to protect your vagus nerve, we can help to safeguard ourselves against chronic disease, chronic stress, excessive adrenaline levels, and increased cancer risks. Okay? Thanks so much for tuning in today. We really appreciate you. Like I said, I gave you some practical tips and practical resources to check on this, to read more. And yeah, like I said, take care of your body. Seriously, this is not a drill. Your life is not a drill. It's happening to you one day at a time. Okay? Sitting on the sidelines does not work. You got to be proactive. You got to take active action in your health. And you basically just have to not die, right? That's the MO. Don't die should be your resounding calling thing. That should be your calling. That's your calling card right there. That's your persuasive term right now. Don't die. That's it. It's not living. It's don't die. As long as you can not die, as long as you don't die, then everything else over time basically can work itself out. So that's what you need to stick to. Okay. All right, good. So anyway, if you guys have any questions, please don't hesitate to ask them. There's another thing I want to post here in Facebook. This is the thing I'm posting right now is just a quote from the paper. So it reads as follows. So T cells that are chronically stimulated by adrenaline enter a cancerous state known as T cell exhaustion. Sympathetic nerves from your sympathetic system, your fight or flight drive, if you're having constant fight or flight responses, it is a ticking time bomb that cancer can develop in your body. This drives tumor growth. And it's driven by noradrenaline on the beta-1 adrenergic receptors of T cells with implications for cancer treatment, obviously. So this is important to know from a perspective of how can we prevent cancer from forming and potentially looking at how to treat cancer further in the future. So that's good news. But yeah, basically we know that how much the vagus nerve plays a role in preventing T cell exhaustion. This is right up our alley here in the Facebook group. You guys think we're limited to, humming and breathing and gargling and sticking our fingers down our throat, but no, we're not limited to just these things. This vagus nerve thing opens up a wider conversation than just like, little dinky little TikTok videos, right? So anyway, all right, guys. So thanks so much for watching. We're going to wrap it up there. Have a great rest of your day. Don't worry. Keep on breathing. Keep on staying calm. Okay. And we'll be talking a little bit more about some of the sonication options for people. Should you be in that 40, 50, 60-year-old level and you are concerned and you want to incorporate something that is very effective at keeping you good, right? Such as Shar here, right? So Charlene, prior to signing up for the program and prior to doing sonication of her vagus nerve with my assistance and my oversight, was arguably, would you say, a little stressed. Now that things have turned around and she's been stimulating her vagus nerve consistently, she is like the calmest cookie on the planet. Yes, things in life can be stressful. That's true. But she's not, she has the resources and the skills and the tools to properly regulate that. So I would bet thousands of dollars. I would literally put thousands of dollars on the line that would show that Char's health right now is on a way better trajectory than it was prior to joining the phase 1 program. Yeah, she's right. She writes new person ! It's very fantastic. Love it. That deserves a love and a heart. And so, I want to say you don't have to worry about developing cancer. I think we should all take part in trying to prevent anything like that. But like I said, I would literally bet thousands of dollars on her as my racehorse, currently in her current state and her trajectory, that tumors or cancerous growth is not going to be a factor, as I know a lot about her health, what she does, what goes into it, how she stimulates her vagus nerve. She follows all the stuff that we did in our 5-day challenge. So she's doing a fantastic job. And also we'll be putting out some information on the 5-day challenge. It's a free challenge, which you can join here. We'll be doing it in about 2 weeks from now. So in about 2 weeks, we'll be doing a free 5-day challenge, and you can learn all about the stuff that we do in our program and take away some good tips and tricks. So if you want more guidance, then I encourage you to join. So awesome. Cool. Thanks so much, Char. Yes. Good job. And thank you, TK. Good info. Thank you. Good. Yeah. I mean, some life-saving stuff here, right? Preventing cancer, I think, is a pretty pretty high priority aspect of health. So, well, anyway, I gotta run. I got a couple calls I gotta get on to. Have a great rest of your day, and I'll talk to you, cool cats, again tomorrow on Friday. And take care of yourselves. Okay, bye bye.